today is all about sharing the work that the teams have been doing over the last 20 weeks around improvement. All the improvement ideas have been their ideas, and they are the ones that are working through them. And it's a celebration of what they've managed to achieve in that 20 weeks.
Listening into Action has empowered our staff to generate ideas, no matter how small or large those ideas are. We empower them to address those initiatives and take them forward for the benefit of our patients.
It absolutely links into what we're trying to do around Better Care Together, not just as a trust, but as a whole system, focusing on our whole population.
We do hear about the different projects that are going on, so it's an opportunity to come up and see what's been done, what the outcome's been, and how the different projects might relate to your job and how you might be able to add to them or take from them.
This is about improving the care for patients with dementia that are cared for on every single ward in our hospitals. I'll stop speaking now because the video will say it all.
This is our brand new day room. We've got a large flat screen television, a My Life software computer which is portable, some music, a large open bright window.
If somebody's in hospital with acute back pain, I'm in hospital, I'm unwell, this is serious. If we can get the right advice to them that yes, this really hurts, however it's fairly normal, we can stop that becoming a chronic picture.
Initially when we started, we wanted to change the world, you know, but that 20-week time frame made us focus in on what's achievable, so you can actually get things changed rather than having these ideals, which has been really useful.
It was quite interesting that, you know, as clinicians and as registered nurses, we were all thinking about, you know, the technical type of things that, you know, we need to do to reduce falls, but they were actually coming up with, you know, storage.
Today I've been presenting on how we're looking at reducing harms that people sustain from falls in a more sustained way, and to reduce them even further than we have already within the Trust.
This is one of those injuries where patients maybe don't know what's actually available, and some indeed medical staff don't know what's available in terms of managing these injuries. We've worked really hard on this project. It's really nice to be able to show off what we've achieved in that space of time. It made us think outside the box and come up with some creative solutions for those issues. Patients on our pilot pathway could save time and also receive a better service by being referred directly to OT from PCAS.
We do have a shortfall for about 53 new patients a week and about 103 follow-up referrals that we haven't got capacity for in the system.
And yes, our aims were reducing that number of attendances and possibly reducing from 3 to as little as 1. We planned a pilot to look at this new model, which we're very pleased will be starting 6th of July.
We realised that we had to put something in place to begin to collect feedback on our performance and the patient experience.
First thing we did was we've created a patient information leaflet, so when the patient comes in to have any type of procedure done, it will give them information regarding our services.
Is really a very good opportunity to have your ideas listened to and to do something that you feel really passionate about, that you feel that you can make a difference at for the people that we serve.
Looking at from a patient perspective, you know, we're hopefully making some significant changes here, and that's going to really improve their journey.
So we're actually probably the first trust who will have, for some staff groups already, which is your critical care and your maternity services, have actually nailed down what are we saying is job essential. So if you're in that role, that's what you're going to have to do.
We've been working together on our project, which really is all about how we improve our communication with you, our colleagues, and how we improve our training of you, our colleagues as well.
What we looked at is just amending our site slightly to have some key areas that you could view.
We've written like the presentation elements of it, and we've started developing questions around it. So I thought we'd just trial a few of the questions on you today. Lots of statements, you just need to pick the ones that are true. Not what you think are true, the ones that are actually true.
We went through case presentations, audits, try and raise awareness
and get some engagement with the consultants to actually agree that they needed to review their patients on a regular basis.
The main thing we've done is raised awareness that actually we weren't looking after these patients as well as we could be.
Well, listening into action is part of our quality improvement strategy going forward. It's the approach that we take in terms of helping people to really deliver on the improvements. And it's also helped support the sustainability programme and moving us towards better care together.
It's quite focused on what our ultimate goals are, which is to have a healthier population, better sustainable care, and frankly, I don't think we can be without it.
It's really important that listening to action is taken forward so that we celebrate our improvements and get the message out to the public that we are a good organisation. We do take on board ideas and we listen to our patients and our staff so that we constantly improve the organisation.